Your kids have been on winter break and you notice one of them seems a little unhappy. Now is the time to assess his or her mental health before they head back to school in the new year. Here with some warning signs is pediatric psychologist Dr. Timothy Jeider from Nevada Mental Health. Thank you so much for joining us.
Thanks for having me.
Let's talk about this. I have children. Do you have children also?
Oh, I say I have hundreds of children.
Hundreds of children that you help,
with.
yeah. What do you do when you see that your child is abruptly changing their routine?
So you want to always compare it to what have they been like before? Is this brand new? Is this behavior that you've never seen before? That could be an indicator that something new is going on, that they might be suddenly suffering from something like depression or anxiety. So that change is what you're looking for.
What are some of those changes that you might see?
So skipping out on family activities, right? Whether it's family meals, going out to stores together, starting to isolate in their room and spending all their time there rather than with a family can be an indicator of depression.
What are other indicators of depression or anxiety that we should be on the lookout for?
So irritability, crankiness, being a little snappier than usual, which can be hard to gauge in a teenager sometimes, right?
Exactly.
But that irritability can be a sign of both depression and anxiety.
Now, what about physical sickness, where they're constantly getting sick, or they're saying they don't feel good? Is that something we should be aware of too?
Very, very tricky in today's day and age with the COVIDs and the RSVs. So it's hard to know, but the mind-body connection is very real. So when you start having unexplained headaches, real just general stomach pains with no real cause, that can be that mind-body giving you a heads up that there's a high level of anxiety. That nervous stomach can be an upset stomach, and so that can also be an indicator of anxiety in young people.
If you feel that your child is suffering from anxiety or depression, what are the next steps? How do we get them help?
So reach out to your community. There's a lot of great providers out there. Nevada Mental Health has a lot of services that people can access, but really just find someone who you can talk to just get an assessment to be like, hey, is this typical? Is this, something that's short-lived, or something more concerning that needs more in-depth look?
Great advice and great information. Thank you so much, Dr. Jeider, for joining us.
Thanks for having me.
Well.